So I started today talking about CBD, and I'm finishing today talking about weight, which reminds me about 15 years or so ago, I was getting off the airplane in Columbus, Ohio, and this rather heavy-set woman looked at me and she goes, "Oh my God, you're Dr. Lombardi." And she proceeded to tell everybody waiting for the next plane, "That's my doctor. He's the fat people's doctor." So, and those of you who know me know that I don't say no usually to weight. But how are we going to help these patients? Because typically when we see them in the office, it's a nice little short visit. We might mention something about the importance of weight reduction with respect to their overall health status and the longevity of their implant. But now I have something else that I can offer them, and this is the remote patient monitoring. And at least I think it sets up the initiative on their part. If they want to participate in managing their weight and adopt this program, then at least I know that they're putting something into the game, because I'm going to take on performing their operation, which we all know is a little more difficult. So I want to discuss what is patient monitoring, how does it benefit the patient and our practice, the fact that it is insurance reimbursed and therefore it's an ancillary service for us. And we are addressing the obesity of America with this, and we're encouraging a lifestyle change, and I'll show you some of the results we've had. Now, the digital health landscape has definitely changed. We all are keenly aware of the fact that COVID has really helped us with this, and things to the left of that screen, such as telemedicine, as we heard about earlier, and remote patient monitoring, whether it's physiologic or therapeutic monitoring, are here, and they're here to stay. So what is this remote patient monitoring? It's also known as physiological monitoring. It involves the collection and analysis of patient physiological data used to develop and manage a treatment plan. There are 4 codes now that are available, and you see them listed here. So there is reimbursement to the physician, allied health professionals if they want to adopt this type of technology. Physiologic monitoring is actually the collection of biological metrics, and it's data that's automatically uploaded to an online program. It's real-time data collection. Therapeutic monitoring, on the other hand, is self-reported data by the patient, sort of what we saw with what I believe Dr. Zach Bird was presenting earlier. So why remote monitoring? Well, it benefits your patients. It's real-time treatment at home. It extends the care beyond that little visit I had in the office. It can boost my practice reputation because now I'm getting involved in not only giving them the orthopedic treatment they need, but I'm trying to look at their overall health. And it's full service, and it is definitely ideal for smaller private orthopedic practices. The mission is to transform the lifestyle of the patient, to give them optimal life and improve their wellness. They're sort of teach them virtually how to get involved in maybe some gym workouts. There's a mobile device, a scale, and therefore it's a full service remote patient monitoring. It can be self-pay, but as I said, insurance can reimburse this, and it's for many chronic conditions other than just obesity. But for us in the world of osteoarthritis that I'm dealing with, we do have many obese patients that come to us with problems. And we do know that, you can look at this data, there's everywhere you turn, there's a growing problem with obesity. Just walk around, look around, and you can see it day in and day out. Now, those of you who look at the scale say, "Oh, that's Lombardi's weight that he's gained since he started back in 1987 through today," and you're absolutely right. That is the way my weight is going. But actually, that is the BMIs of our patients, where they were down around 31, and I don't believe this at 34, because I think most of us are operating on 40 plus. So, but this is the data that was put together by our research team. So, the bottom line is people are getting heavier, we're operating on heavier patients, and the patients need our help. And I think that counseling them just briefly in the office and saying, you need to lose weight isn't all we can do. We got to have a better option. And the better option is that we offer them a personalized experience. We educate them on proper nutrition and exercise. We check on them regularly. We monitor their results. We hold them accountable. And so we therefore can hopefully have them lose some weight. And so we've gotten some good results. 80% of our patients are retained for 9+ months, 90% compliance with the virtual program. We have patients average of 5.4% weight loss after the first 16 weeks. 82% in severe pain saw a reduction in 31 days, 41% increased daily water intake, and there was improvement in mobility, energy, and actually some improvement in A1C. So we're helping some diabetic patients. And we can look at it also as a new ancillary service for our practice. We have DME, ASC, PT, we have our PAs, our nurse practitioners, but we can also now have the remote physiological monitoring. And I think at the core of that is that data collection of this physiological data. Basically, we're collecting the data from the scale onto the mobile device. So the data is transferred without human intervention. These are accepted by the FDA. And they are ordered by us, and then ultimately, as I said, we can bill for those services. And I think it improves our efficiency of care, it encourages patient engagement, it extends our oversight, and obviously it's going to improve our outcomes because patients are now more engaged and are losing the weight they need to lose. So here's some more data from our practice. Our total weight loss has been 6,164 pounds. I wish I had lost a little bit of that myself. 32% of body weight lost and over 113 pounds, 15.8% average weight loss after 2 years in the program. Some patients are actually been in there that long. 85% of the patients in severe pain, as I said, saw a reduction, and 15% have no pain today. So our average patient age has been 67, 192 days average time in the program. 40% of these patients are still actively enrolled. 13% are enrolled for more than 365 days, and 83% of patients were enrolled via the Fast Track to Health Patient Outreach Program, which means I am handing them the brochure, and then they are being contacted by it's called Prescribe FIT. They will contact them and get them into the program. So I do think this is a solution. Patients themselves are reporting that they like this and that they're interested in this type of monitoring. And then there can be multiple ways of helping the patient lose the weight. So it's a mobile app, as I said, a Bluetooth low energy smart scale, patient outreach with these care coordinators, going over lifestyle changes, and then there's a dashboard that I review, and as I said, it's reimbursed. So here's the program. We provide them with the pamphlet. They get contacted. There's an outreach from the Prescribe FIT. There's weekly health coaching calls to the patients. The providers given those reports on a monthly basis. We review them, and then there's the codes, as we said. So here's the portal I can look at, the mobile app for the patient, the smart scale. You can see you can track your health in one convenient location on the phone. You can communicate with your provider. There's the scale, then the measurements. You record your weight every morning. You follow up with workouts throughout the day, receive personalized health coaching tips. You view your completed exercises and record meals with pictures and ratings. You engage in educational pathways to understand your healthy choices. There's some motivational things, reminders to get on the scale, to make sure you're staying involved. You receive announcements and reminders in the app. You can view your progress towards weight loss. So there's lots of things that are involved. As I said, increasing your water intake, tracking your meals, and at the end of the day, I think that with this mobile app and with this coaching, as I'm talking about, we've seen the success I've reported. So thank you so much for your attention.